I'm John Moore. I'm a senior staff photographer for Getty Images. I decided to go to Liberia this summer when I read a report from Doctors Without Borders, MSF, that the situation in Monrovia was potentially catastrophic for the Ebola epidemic. When I first arrived to Liberia, there were very few journalists there on the ground, at least internationally. MSF was there with the treatment center, and others were being built, but still the capacity was very low. There were people being brought in ambulances to Ebola treatment centers and being dropped off at the front gates, and they lay on the ground because there was no place for them to go. There were no open beds for them. I found that an isolation ward for Ebola patients had been opened. It was very dark and very eerie and frankly quite scary, and I'm sure it was for the patients. There were sick people, there were dead people on the floor, there were healthy people sitting nearby in mattresses. It was horrible to see. A health worker tried to move one man to another room because he was laying near a dead body. His name was Ibrahim. He got up and he walked towards the door, and suddenly he lost his balance and he fell back. I still hear the sound of his head hitting the floor. His wife rushed in and she stood over him. She didn't know what to do. She knew she wasn't supposed to touch him. It was a very helpless and horrible situation, but I think it was important to document. I was there in West Point when a mob drove out a burial team in a hail of stones. This team had come to collect the bodies of 4 people who died in the neighborhood. People really didn't believe that Ebola existed in West Point. It was terrible to see these health workers running away and fleeing a mob. But then the mob marched on the isolation center and pulled the patients out, telling them that they didn't really have Ebola and that they would be fine. And so people who were very sick were sent out into the community. Family members come down with the sickness for the very reasons that make them human. Caring for a loved one who's sick, cleaning a loved one, and if that person dies, washing the body. In that way, Ebola has been very dehumanizing for Liberians because they've lost the ability to comfort and touch. When ambulances and health workers come to take away the sick, family members know that they may never see that person again, because if their relative dies, they'll never be able to see them, they'll never have closure. I think it's been important to go back multiple times and to show this epidemic as it's increased and the terrible effect on the population, the fear, the death. You can't do that in a short trip. I think the international community has learned that, that this disease is not finished, and it still has a long way to go.